Hello everyone, my name is Hubert and welcome to Teach Me channel. Today we'll be looking at GCSE Biology Cardiovascular Disease Continued. So last time we were talking a bit about what cardiovascular disease is and about stents and statins, the two sort of go-to treatments when it comes to coronary heart disease. Now we'll be looking at some further treatments, perhaps more complex treatments that can be used to help us deal with cardiovascular disease. So, what if we have a heart fail completely, or certain heart valves fail, or if we have sudden massive loss of blood? What do we do in those cases? Without further ado, let's get started. So first of all, what happens if, say, somebody has a heart attack and we unfortunately cannot save the heart, or for whatever reason, the person's heart is no longer functioning and is beyond repair? Well, in this case, we have two options. We can either give that person an artificial heart, or we can transplant a heart from a donor for this person. And both of these treatments have their place in medicine, and both of these treatments have their uses. However, due to their advantages and disadvantages, they are used differently. So let's start with artificial heart. Artificial heart is made from artificial parts, plastics, metals, some ceramic parts. And therefore, because these are artificial parts and they are not recognized as antigens by our body, there's a low rejection risk for users of artificial heart. So, low rejection risk. As opposed to heart from the donor, where if you're transplanting a heart from somebody else, that's the biological tissue that comes from somebody else, and it will have different antigens and will be recognized by our immune system, and there is a risk that such a heart will be rejected, unfortunately. So back to artificial heart. Artificial heart, unfortunately, it mostly makes sense to use it as a temporary fix for many reasons. We will go into those in a second, but it's artificial heart mostly is a temporary solution, at least. Sometimes it can be used permanently, but really you want it to be only a temporary fix. Whereas a heart from a donor is a long-term fix. A person with a heart from a donor can lead a relatively normal life, and that heart will last them a while if they look after it. So it's a long-term fix, and it's a really good treatment. Now back to artificial heart. Artificial heart is readily available, right? So you can make that artificial heart and give it to that person. There are companies making those, the entire health services making those, so it's nice, readily available treatment. However, heart from a donor, of course, to get a heart from a donor, you need a donor that has died recently, for example, in an accident or something like that. So they have and that heart needs to be functioning. It cannot be damaged. It cannot carry any bloodborne diseases. And, of course, the antigens on that heart, the molecules, the type of the tissues on that heart need to match with the recipient, the person who's going to get that heart. And because it's such a selective procedure, there is not many donor hearts. There is simply not enough hearts out there for everybody. And therefore that means that those people that need hearts will have to wait for a very, very long time, sometimes even years. So, of course, that's a big issue with hearts from donor, and for that matter, actually, any organ transplants will struggle with that. So low donor supply is a major, major issue when it comes to getting a heart from a donor. So that's a big, big advantage for artificial heart, where you have a readily available treatment. However, artificial hearts are not as effective. Because they are made from different materials, the blood doesn't pass through them as easily and can clot. And also artificial hearts are prone to breakages and failures, so they are simply not as effective, which comes back to why artificial hearts should be treated as a temporary fix. Whereas hearts from donor, providing that it's in a good condition, which it should be, it's effective. It works like any other heart, and like I already said, that person receiving that heart will be able to lead a relatively normal life. Back to artificial hearts. Artificial hearts carry a blood clot risk, like I already mentioned, because that heart is not made from the same material that a real heart is. So, because of that, people having artificial hearts will require blood thinning drugs, which can be a problem for some elderly people because those drugs can have nasty side effects. So that kind of gives away that artificial hearts may actually be a better solution for younger people who can handle those drugs, as opposed to elderly people who may not be able to deal with those drugs so well. Although that, of course, comes down to an individual. However, hearts from a donor also carry their own issue, because hearts from a donor have a high rejection risk, and they have the whole issue of antigens, and they have a whole problem of being rejected by the host immune system. The person having a heart from a donor will require immunosuppressant drugs for the rest of their life, and those drugs suppress their immune system, making them more susceptible to other diseases and infections such as pneumonia and things like that. So that's also a big problem. So that's it for replacing a heart. However, what if we don't have to replace entire heart? What if a heart is functioning, but we just have to replace heart valves which became leaky or became stiff due to some infection or old age or any other reason? What if we just have to replace a valve? Well, in this case, we also have options. So, when it comes to valves, we have an option of giving a person mechanical heart valve made from ceramic, or we can give them a biological heart valve, which usually will come from an animal, usually a pig, to be honest. So, what are the advantages and disadvantages of those two treatments compared to each other? Well, let's start with mechanical heart valve. Mechanical heart valve lasts up to 20 years. It's made from ceramic and some other materials which are very, very durable indeed, and they last for a long time. Whereas biological heart valve doesn't last quite as long. It simply just doesn't last as long. It's made from biological tissue, which also has its age because that animal that it came from had certain age, so they just don't last as long. However, on the flip side, mechanical heart valve carries a blood clot risk because it's a mechanical part. Again, like with many mechanical parts, the blood doesn't flow through them just as well as it would through a natural part. So it carries a blood clot risk, and therefore it may require people to take blood thinning drugs. Whereas biological heart valve, because it's made from biological tissue, that would be present in a heart, it carries doesn't really carry significant blood clot risk. So those people do not have to take so many blood thinning drugs. So again, here we can see that because of those blood thinning drugs that elderly may struggle with, mechanical heart valve may be a better solution for younger people, whereas biological heart valve may be a better solution for older people. So, again, it's down to the doctor and the patient to figure out what's best for them. So, the final thing we need to cover in this video is artificial blood. Now, artificial blood is essentially saline solution, and it's used, for example, in accidents or surgeries or many other scenarios where a person lost a lot of blood. It's used to replace the blood volume. So if a person loses a lot of blood, you can put in a lot of saline solution in them to bring back that lost volume, to replace the volume, and to allow the heart to pump. Because, of course, heart pump has to have a certain volume to work. It's kind of dependent on the pressure, internal pressure of the system. So we need to have that volume to allow heart to pump blood around the body. So this is very important. So saline can help us achieve that, and it saved countless lives. Even people who lose as much as 2/3 of their blood can actually recover if they are given saline. That's a very good point. However, saline does not replace function of blood. Saline does not equal blood. Saline doesn't contain red blood cells that carry oxygen. So whilst we're replacing the volume, we are simply not replacing the function. We are just hoping here that by replacing the volume, by allowing that heart to work for a bit, in due time, the bone marrow will be able to produce extra blood cells to replace the ones that were lost. So it doesn't work as in terms of replacing function. If we need to replace the function of the lost blood, simply we still have to rely on new blood. In other words, the person will require a blood transfusion. So they will have blood put into them, external blood from somebody else, and that will allow them to function normally. Whereas saline only replaces the volume. That's an important thing. However, there is some research happening currently that is aiming to create artificial blood that can replace the lost volume, but then also can replace lost function. So that's interesting. So this is it for today, guys. Thank you very much for watching. I really appreciate when you guys watch my videos. If you want to stay up to date on more videos like this on biology, on GCSE biology, A-level biology, A-level physics, GCSE physics, A-level chemistry, and GCSE chemistry, as well as GCSE maths and some biomedical science videos, don't be shy. Hit the subscribe button below. Thank you again for watching. If you think this video helped you, give me a thumbs up, and see you next time.